afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin. Joining me today is Miss Cilandell Glen, and she's the Adolescent Health Focal Point Acting. Welcome, Miss Glen.
Hi, Alicia, and thank you very much for having me on the program today. It's always an honor and a pleasure to be a part of Health 360 to share with our viewers and our young people as to what adolescent health is doing at the Ministry of Public Health.
It's always good to have you, Miss Glen. Our topic for today is COVID-19 in adolescents. Miss Glen, could you tell us about some of the activities that you guys have ongoing right now?
All right, great. For the adolescent health unit, I must say that we had to really restructure and refocus our activities that we had planned for the year 2020. And this is due to the fact that COVID-19 is in our societies, in our country. So what we are doing right now is that we have moved all of our activities virtually. So for the period of May to July, we are hosting a series of Facebook Live shows that is called Adolescent Health Living Gaff, and it focuses on providing information to our adolescents and young people on health and social issues that affect the target population. Today, later on today at 3 o'clock, we will be having our fourth show that will be focusing on coping with depression and to explain to our adolescent viewers and population how they could actually cope with depression during the time of COVID-19. We also have ongoing a video competition where we're asking young people to upload videos to our Facebook page, the Ministry of Public Health Facebook page, our Adolescent Health Facebook page, on activities that they could do while they're at home. We're encouraging them to promote staying at home. So once they're participating in the video competition, they have to use the hashtag stay at home. So that's one thing that we're doing. We're also moving towards having our peer educators training. As you know, the department have peer educators within various regions that we use to disseminate information to the general public. So we will be having in July a peer educators training for persons within Region 4. So if any young persons between the age of 10 to 24 want to join the adolescent health department and become a peer educator, you could feel free to contact us on 223-5310 or drop us an email at adolescenthealth.moph@gmail.com or even leave a comment on our Facebook page. We also are working towards reaching out to our secondary school health clubs. That's another initiative that the department have. So for this period, we will be doing some continuous education with our health club students or more so our health club members. We will be providing them with information on drugs, alcohol, even COVID-19, mental health, and all the issues that are affecting young people. So those are just some of the things that we have planned. And also we're working towards ensuring that our live Facebook series, Lewi Gaff, is accessible to all of the regions. So coming shortly, next month, June, we will be working on airing those live shows on Voice of Guyana so that it could reach the interior location so that all our adolescents throughout Guyana could be involved in what we are doing, not only Region 4. So Alicia, that is basically some of the things that we are doing. We know that we can't do a lot in terms of reaching out to the communities and physically going into the communities because we are practicing physical distancing, which is one of the mandates or one of the orders according to the public health ordinance and also recommended by WHO. So we're really, really trying our best to ensure that our adolescents and young people still have access to the correct and accurate information. And what best way to do it than using the platform that they're constantly on, which is social media.
Yes, definitely. You guys are doing a whole lot down there. Keep up the good work.
Yeah.
How have persons been responding to the live series thus far?
Well, just far I could say that it's not overwhelming, but we are not shocked. But we have a good amount of views. For example, our show last week, which focused on domestic violence, we had about 200 views. And the good thing about it is that the video is on Facebook, so persons could go back and continue to
Yes.
look at it, so the information would remain there. So I must say I'm quite impressed at the response, and I'm happy that we're getting a good turnout when we have our live show. And the thing about it, Alicia, is that this program or this Facebook Live is not only targeting adolescent population, but it's also giving the parents and the guardians the
That
opportunity to join and to learn about some of the things that they could discuss with their adolescents or with their children, their neighbors, their nieces, their nephews, while they're at home during COVID. So it's really, really a good initiative. And I must say, thank you very much to the staff of the department and also our wonderful pre-educators who are usually the hosts of these shows on Wednesdays.
great. So tell us about the impact of the COVID-19 pandemic on the adolescent community.
Wow, that's a really, really good question. COVID-19 has tremendously impacted every aspect of society, not only when it comes to adolescents, but I think adolescents would actually feel not necessarily blunt of it financially, but when it comes to staying at home or practicing social distancing, adolescents are accustomed to being out there. They're accustomed to socializing with their friends. They're accustomed climbing on the seawalls. They're accustomed climbing after school. So for them, one of the major impact it will have is on their mental health. And as we know, mental health is something that we need to pay close attention to. During this time of COVID-19, what we will find happening with our adolescents is that we will have an increase in mental issues or disorders such as anxiety and depression because they're at home. There are only certain amount of things that we could do whilst we're at home. We have to readjust our behaviors. We have to readjust our lifestyles. And I find or I believe that adolescents are not, what to say, developed or trained to always be at home. So they're accustomed to being outdoors, right? So that is one of the major impact it will have on their mental health. Another thing it will have on their physical health. Being at home, if you're not in the environment to exercise, to eat healthy, we could see an increase in childhood obesity, or we could see an increase in our adolescents becoming overweight, for want of a better term. So they must be able, when they're at home, to practice healthy eating, to exercise. So we're encouraging our parents out there to ensure that you speak to your children, speak to your teenagers about what they need to eat, to the importance of exercising, because being at home, I know some adolescents are currently exposed to online learning. Being at home, sitting in front of a computer, not eating healthy will contribute to an increase in weight gain, whether it's around your tummy area or your entire body. So we have to be able to balance what we're doing at home. We must be able to put aside time for our schoolwork, time for eating healthy, time for exercising, and even time for reflecting as young people. Most of the time we find that our adolescents don't take that 5 or 10 minutes during the day to reflect on what is happening around them, what is going on within their lives. So I believe that those are the two major challenges or the two major impact that COVID-19 will have on our adolescents when it comes to health. In addition, it would have a big impact on their academics, because some schools are not doing online learning. Some students are currently preparing to write CSEC examination. They're preparing to write their CAPE or the higher level examination, whether it's university or sixth form or CXE. And this is a period of time where certain things is delayed. We know that CXE is usually in May, June, but now the actual date for the CXE examination is not finalized as yet. And this will now mean that our academic journey will be postponed, our career plans will be postponed, because we will now have to reshift. If you're supposed to be graduating from the University of Ghana in November, and you're expecting to start your career in December, you're expecting to start your master's or your higher learning during next year, this entire process might have to change. We might have to refocus. It will have a lot of delays. I know one of the things that is happening around the world right now is that a lot of graduations are being canceled or postponed, and that will soon affect our Guyanese society, because you will see that our CXC students will not be able to graduate to start university in September if this pandemic continues throughout the rest of the remainder of the year. So those are some of the things that I see that would affect or have an impact on the adolescents.
So, for those adolescents who understand that their education is being delayed at this time, what would be your advice to them? What are some of the things that they can do while they're at home currently?
Okay, my advice would be don't give up. You have a purpose, you have your goals, and you have your future ahead of you. So regardless of if you're able to finish your CXC before September, you must know that there would become a time when you will be able to do that. Just don't give up. Continue studying first and foremost. You have to study. If you want to come out successful, you have to continue studying. Use this time that you're at home to do research. For those students that are in that are writing CXC, use this time to reflect, to plan your career path, to plan exactly where you want to go in the future, because planning a career is not easy. You have to take a lot of turns. You have to go up a lot of hills, up wrong a lot of bends, and these sort of things. So you have to know what you want. So use this time to do that research. Not only university of Ghana programs, but look at programs in other countries that you want to participate in. I think sometimes young people run away with the fact that the only career they are becoming a doctor, becoming a lawyer, becoming a policeman, a soldier,
There's so many
right?
others. Mm.
Yes, there are so many other career paths that you could take. And based on your class, based on your stream that you're in, use this time to research some of the career paths that are not so prevalent in Ghana. Look at the ones that are out of the box, right? For example, I know that there's a lot of career paths in forensic toxicology. I heard on Facebook yesterday, one of my friends, because I know her, she was talking about her journey towards becoming a forensic toxicologist, right? So look at other careers that you could get involved in. Look at things that you're passionate about. Look at things in terms of not only academics, but look at business ideas, right? Life after COVID-19, I'm sure there would be the avenue for us to engage in so
Yeah.
many um, businesses. So think about some of the things that you could do as a young person. Think about some of the things that are missing from society, and use this time to actually draft a business plan, work on something. Use this time to work on your physical health, to plan exercises that you could do with your friends or with your family. Use this time to work on your mental health. So there's so much things that we could do. Use this time to build relationships with your family, with your parents, your siblings, because most of the time Guyanese have this busy lifestyle where they're in and out, in and out, in and out. So you could use this time to work on your family relationship and build healthy relationships.
Also, not forgetting and healthy relationship with
Yes,
yourself as
healthy.
well. That
Correct.
is very, very important. What should an adolescent do if someone in their family becomes really ill with COVID-19? What should they do?
Well, the first thing I would say is actually follow the mandate that is out there by the World Health Organization. So as we know, the Ministry of Public Health um, would have a series or a number of hotline numbers that persons could call if they're suspected of having COVID, or even if a family member is suspected of having COVID. So I would advise them, first thing to do is to isolate that family member. Now I know that we're not medical doctors, or we might not be trained in the medical field, but every single day information on how to deal with COVID-19, how to deal with if your loved ones is suspected as a COVID-19 case, is constantly played on the radio, the TV, even on the Ministry of Public Health Facebook page, even on other social media platforms. So the first thing you will have to do is isolate that family member, sanitize your surrounding, ensure that you wear your protective gear, your mask, your gloves, if you have gloves at home, and call the COVID-19 hotline numbers. If you're not able to call those hotline numbers, the Ministry of Public Health would have launched app where you could go on and fill out the questionnaire, log on, and get the information out there. And once that is done, be assured that someone from our health emergency unit would contact you and would take the necessary measures, whether it's coming to your house, whether it's walking you through what to do at home over the phone. And be assured that help is here. We are working tirelessly to ensure that the curve is flattened. So just take those steps. Isolate your family members, wear your protective gear, sanitize the areas, and contact the health, the COVID hotline numbers, right? So that is what I would advise our adolescents to do.
Definitely. Also, persons can feel free to check out the Ministry of Public Health Facebook page. That is Ministry of Public Health Guyana. Check out our Facebook page for more updates on COVID-19.
Yes, because updates are being placed every single day. We even
Yes,
have a special program that would bring the updates every single day in terms of the numbers that we have, the number of deaths, or testing sites, because we have mobile testing sites to ensure that presence within the community. As adolescents, you can equip yourself or empower yourself with all these information. You might be feeling bored at home, but once you equip yourself with these information, you can now share this information on your social media with members in your community whilst you're at home, whether it's on the telephone or via text. You could share this sort of information. So ensure that you equip yourself with the information, but don't overload yourself.
definitely. What can parents do to help adolescents understand the COVID-19 pandemic?
For me, it all come back to educating your children, educating your teenagers. Take time to visit the World Health Organization website, the ministry website, CDC website. And I'm saying these websites because we know that these websites are the ones that will provide the correct information on COVID-19. Um, Propaganda is a serious thing, misinformation is a serious thing, and we don't want to visit all these sites that have the incorrect information, and then you're pouring this information into your children's head. So visit these sites that have the correct information and sit probably 5 minutes every single day and speak to your children about the importance of staying at home, the importance of, if they're going outside, to wear a mask, wearing the mask correctly, washing their hands, sanitizing their hands. So as parents, you have to take that time out of your busy schedule. I know that some of you are still working because you're essential workers. Some persons have to work, but take 5 minutes of your day and speak to your children. There's no harm in sitting down and talking to your children. We all know that communication is the best thing possible out there. So you need to communicate, and not in a harsh manner, but you need to communicate effectively so that your children would understand the importance of COVID-19, because together we can, and together we can flatten the curve, and we can't expect the Ministry of Public Health alone to do it. We have to work collectively towards achieving this goal.
Definitely, a collaborative effort is needed to
Yes.
combat COVID-19. Before we end today's program, do you have any coping strategies for those adolescents who are at home right now?
Most definitely, Alicia. What I would say, I will leave you with three things. There's a lot of things that we could do to cope whilst being in isolation, but you have to connect with your loved ones, connect with your family members. And as young people, we know how to do this. We know how to use social media. We know how to use TikTok. We have Zoom. We have so many platforms that we could use to connect with each other. So I would advise you to continue connecting with your peers, with your friends. Share what is on your mind. Talk to someone, whether it's a family member, a friend, or a healthcare professional or a trained professional. If you want professional help when it comes to coping, if you feel like you're suffering from anxiety or depression, there is the Ministry of Public Health Mental Health Unit, and they can be reached on 226-1407 and 226 1406. So you could contact the Ministry of Public Health Mental Health Unit. They are trained psychologists and social workers that would be able to provide counseling to you. In addition to that, if you don't want to go the route of coming to the public services, you can connect to the private services. There are a lot of private facilities out there that offer counseling. So you could be sure to connect to those persons.
Okay, thank you so much, Miss Glenn, for joining me on the program today. It was quite informative. I do want to encourage you guys to keep up the good work that you are doing at the Adolescent Health Unit. Thank you once again.
Yes, Alicia. You're welcome.
So this has brought us to the end of Health 360 for today.